seniors from CIHP and CAHA on this online workshop on adolescent counseling. Today's topic is basic to advanced skill on reproductive health issues. I welcome our expert Dr. Hima Bindu Madam, Dr. Pyali Bhattacharya Madam, presenter Dr. Lakshmi Shanti and Dr. Sneha Gadkar, guest of honor Dr. Asha Pinakappe and Dr. Puneet A. Pune. I also welcome Program Director Dr. MKC Nair and our advisor Dr. Swati Bhabe Madam, Prokhraj Bafna and Madhushi Deshpande Madam. Now I invite Dr. Prashant for the further proceedings.
So thank you so much, sir. Without taking much of a time, I request our chairperson, Dr. Hima Bindu Singh, ma'am, to give the opening remarks. Thank you.
Good afternoon. Thank you, Dr. Arya and Dr. Prashant. On behalf of the Central Adolescent Health Academy, I acknowledge the presence of everybody here, our chairperson-elect, Dr. Sushma Desai, Madam, and Dr. Geeta Patil, Sneha, all the office bearers, and our mentor and past chairperson, and I should say the one who has mentored all of us, our guru in adolescent health, Dr. M.K. Nair, sir. Sir, a very, very warm welcome to you. Special welcome to you as a program in charge for this whole course of adolescent counseling, which is in so much of demand. And we at Central AHA, as part of the action plan this year, in the Silver Jubilee year, we wanted to do certain programs which will really cause change or impact in the dealing with adolescents or in the profile of adolescents in the community. So one such effort is to have awareness programs in the community through the youth wellness module, and which will cascade down, and then the youth voice which we are capturing through the Wave 18. And the third is of course, this counseling course which will help our adolescent physicians who are the IAP members and other AHA members to develop skills in how to do counseling and in different aspects while dealing with adolescents. So this is we have run many courses over the last 25 years, many modules, but this counseling is a very practical aspect, like, really role plays, and the way what we are doing these last few sessions, we are showing them case scenarios, how to actually deal with such cases when they walk in your clinics. This will really give them hands-on experience and the feel when they are actually adolescent walks in their clinics. This is very much appreciated. A very good feedback is coming, and we through the participants, and there's still there's a demand. We are getting calls that we want to still join the course, and we are allowing them actually, and the recordings are also available of the past sessions. So this all due to our encouragement by Dr. M.K. Nair, sir, who has accepted to be the program director for this course, and all our contributors, all our experts who have come forward to share their experience and conducting the sessions, and of course our coordinator, Dr. Prashant and Dr. Kavita. And all our seniors, Pyali, and all of us are together here. So I really welcome all of you once again and look forward that this will be actually utilized. And in this another very important landmark we are trying to make an effort is to start Yuva clinics. So this will be a landmark if at least few Yuva clinics are established in both government sector and the private sector. And such sessions will actually help the pediatricians to face and comfortably deal with the adolescents. So I think we have the technical session should go on now. And I request Dr. Prashant to conduct the rest of the proceedings.
Thank you so much. So without taking names of everybody, welcome one and all. We directly jump to a first case, and that will be presented by Dr. Lakshmi Shanti. Lakshmi Shanti, I have done a PGDFA under Dr. M.K. Nair, sir, along with you.
Prashant, the topic is, you can announce the topic today.
Yeah, I'm just announcing, ma'am. So the topic is reproductive sexual health. And for that, first we do have Dr. Lakshmi Shanti. She is a consultant child and adolescent health specialist from Coimbatore, practicing child and adolescent practice in Coimbatore since last 18 years. Active member of Coimbatore IAP, AHA and AMA, and held various posts in district and state IAP and AHA. She is also part of various modules in AHA like MKU, IA, MSU, PSP. Done publications in STG book, IAP book on adolescent-friendly pediatric practice, IAP textbook of adolescent medicine, coffee table book of AHA, and speaker in state and national conferences. So I request Lakshmi to start the case, as sir has to leave by 3:30 and you sir can give the input. So, and we do have experts that will be introduced by Dr. Lakshmi Shanti. Yeah, please.
So good afternoon, one and all. So it's a great honor to be part of this wonderful program on adolescent counseling. So I'll just share my screen. Is my screen visible?
Yes.
Okay. So actually, last year, this program, the first part of this program held under the able leadership of a past chairperson, Dr. Geeta Patel, was a grand success. And this year, this program's second part is done under the leadership of our Silver Jubilee President, Dr. Hima ma'am. So thanks for this opportunity. And to all the office bearers, Dr. Prakash sir, Sneha sir, and pranams to our mentor and guru. As Prashant said, we did PGDAP under your guidance, sir, MK Nair, sir. It feels so great to be talking in this platform under your guidance. Thank you, sir. So without taking much time, I'll just dive into the topic per se. So actually, today's topic is on reproductive health. So me and Sneha ma'am have divided our topics in such a way that I will cover certain aspects of adolescent sexuality, and Sneha ma'am will take care of reproductive health and teenage pregnancy. Okay, so adolescent sexuality is a big topic by itself, but I'm not going into the depths of it. In the next 15 to 20 minutes or so, I'm just going to give a overview of what it means and how the sexuality travels through adolescent, and we as adolescent pediatricians, what we should look for, or what is the behavior that we should look for in the different stages of the adolescence. Okay, so now sexuality is a continuous process. It's not limited to a child or adolescent or something like that. It's a continuous process, and it encompasses so many entities like physical, mental, emotional, and finally culminates in the sexual behavior, and then taking further to relationships and things like that. But adolescence is the stage where the sexuality takes a major turn, because we all know the pubertal changes takes place in adolescent. And this is the age where exploration and experimentation is also very common. And in sexuality, like we know that it starts from birth. In fact, even inside the womb. So there are certain factors that determine the sex of a child. So when a child is born, the first question that we as a pediatrician encounter is, what is the sex of the child? So whether it is a male or a female or otherwise. So starting from here and up to the adolescent stage, and what exactly happens is what we're going to see in the next 15 to 20 minutes. Okay, so I've taken my topic into 5 different facets during the adolescent period. The first one is the biological sex, what it means actually. The second is gender identity. The third will be sexual orientation, then the sexual behavior, and finally relationships. So we should know that all these are different entities altogether, but they are related in some way or the other, and they are not the same. So this is the first point that I want to stress upon. Okay, now first coming to the biological sex. The biological sex or the anatomical sex is the sex with which we are born with. So it can be male, female, or intersex. It's also called non-binary. Now, recently the guidelines that we follow, the medical terminology has changed, and we have to term it as disorders of sexual differentiation, because we as pediatricians, we attend resuscitation for a child. So if the sex of the child is not known, or if the child is born with an ambiguous genitalia, we have to write it as disorders of sexual differentiation. So this biological sex depends on the internal and external sex organs, the chromosomes, the chromosomal sex, whether it's an XX or XY or something else, and then hormones. Hormones play a very important role in determining sexuality, especially during adolescence, because we already saw that puberty is a part of it. Okay, now we talked about the anatomical sex. So what is gender? We had a question in the MCQ, a statement saying whether the sex and the gender are the same. So we have to understand first that both are different entities. So what is gender? One's innermost concept of self has male, female, a blend of both or neither, or how individuals perceive themselves and what they call themselves. So one's gender identity can be the same or different from the sex that is assigned at birth. To just give a small example of what it means to be gender. So in one of the classes taken by Samvad by the NIMHANS program, so one of the faculty, he just explained gender in the form of this, I'm wearing this called the dupatta or the shawl. So when this dupatta or the shawl is worn in such a way, like around the neck in such a way, it conforms to a female gender. And when this is worn like across the thing and like this, it is almost conforms to a male gender. So that is what we see commonly in the society. So who determines these things? It's not the individual per se, it is the society which determines. So the individual himself has a belonging, like whether he is a male or a female. And finally, there are so many other factors from the society that confirms that a male should be like this and a female should be like this. For example, we could have seen small children playing like the father-mother game. And we can see that the child who plays the mother will be into the kitchen and cooking things, and the child who plays the father will be out going to earn money and things like that. So who teaches children all these things? So our children learn sex through a gendered lens. So that is what we have to know. So they are imbibed certain changes, that cultural differences since childhood. So when they reach a certain age, so they are like, they believe that this is what uh, a child who's born a girl should do, and this is what a boy should do. And children by the age of 2 to 3 are able to label themselves as boy or girl. And by age 4, they almost have a stable sense of their gender. And what happens in adolescence? In adolescence, there are certain things like the children, the adolescent teenagers, they may experiment with gender. For example, we have seen some girls who dress like boys, and not only the dressing, and they also behave like a tomboyish character and things like that. So there are certain experimentations that take place in the adolescent period. Okay, so we have seen sex, gender. The third part is the sexual orientation. So the sexual orientation refers to whom a person is sexually attracted to. And to classify this, we have what is called the Kinsley scale of sexual behavior. From 0, we have the exclusively heterosexual behavior up to scale 6, which shows the exclusively homosexual behavior. In between these things, there may be varying amounts of lenient towards the orientation. For example, some may be bisexual, they may be both homosexual and thing. And there are so many other terms that like it's not anymore LGBTQ. It almost expands up to I plus A alpha, so many other things that have been added into this sexual orientation thing. Again, in the adolescent period, we should also know that adolescents, usually they have an affinity to form same-sex friendships, and they're close with their same-sex friends. But whether this will continue into adulthood is a million-dollar question, and it is left unanswered, because evidence and research also shows that this same-sex friendship that exists in adolescence does not it doesn't mandatorily extend into adulthood. So it is usually a transient or an experimental phenomenon is what research says. So not every adolescent who is close with the same-sex pals will go into becoming a homosexual. That's what I'm coming to say. Okay, so now we have seen sex, gender, sexual orientation. Now coming to the fourth and the important part of adolescent sexuality, which is sexual behavior. When we go to schools to talk about sexuality, usually there is a resent from the teachers, maybe the parents. They say that it's not necessary. And they think that sexuality is all about the sexual act, or like talking only about like how to do sex and things like that. But actually, sexuality encompasses so many other things, And this sexual behavior is only a part of adolescent sexuality. So we as pediatricians and adolescent pediatricians should understand that we should give this anticipatory guidance, and we should talk in schools more about the sexuality and make them aware of all these things. Okay, now coming to the sexual response cycle, which consists of 4 domains, which starts from the sexual desire and then arousal, then the behavior per se, and then finally functioning. These are the 4 domains of the sexual response cycle. For example, an adolescent may go through all these stages in different parts of their life. For example, an early adolescent may just have the desire. He may have the feelings of urge, sexual interest, etc. And when he comes to the middle adolescence, then he have the arousal, and then may engage in some one of the 4 behaviors that are listed on the right side of the slide. The right side of the slide shows the 4 different types of sexual behavior, starting from abstinence, masturbation, partnered sex, and finally sexting. So abstinence is refraining from all sorts of sexual intercourse, whereas masturbation is self-stimulation. So these are all things that any adolescent will go through in different parts of their adolescent period. And third, which is the most important thing, is the partnered sex activities, which can involve anything from a simple kissing, touching erotogenic body parts. Masturbation here again denotes a partnered masturbation, which means watching their partner masturbate and getting the arousal. And cunnilingus and fellatio refer to oral sex, and finally intercourse, which can be penile vaginal or penile anal. And finally, we shouldn't forget this important part of sexual behavior, which is sexting, which is more and more common nowadays in our adolescent girls and boys. This is something but exchange of sexually explicit messages or even nude pictures between two consensual or non-consensual adolescent boys and girls. We should also know that this sexting, even though consensual, sometimes it may lead to major problems like cyberbullying, etc. So these are the 4 different types of sexual behavior that any adolescent can exhibit. Okay, now having talked about the sexual behavior, the other more important part of adolescent sexuality is the legalities involved in the sexual behavior, which means the age of consent in which one can have sex. We all know that in India, we have an act called the POCSO Act, and the age of consent in India is 18 years. Can anyone in the audience guess what is the lowest age to have sex, or the lowest age of consent in any other part of the world? And even if you want to answer, can put it in the chat box. So talking about the age of consent, the lowest age of consent is in the country of Philippines and Angola, where the age is 12 years. So 12 years is the age of consent to have sex in Philippines and Angola. And in most of the European and in the US countries, it's almost ranges anywhere between 16, 17, up to 18. In US, in different states, there is a different age of consent. And European countries also, it ranges from 16 to 18. So, but in India, we know that the age of consent is 18. And we also have to know a term called the close in age exemptions. So what is this close in age exemptions? So any consensual sexual activity in adolescence between the age of 16 to 18 years, and with the boy is often termed as accused in the case of POCSO. And when the boy's age is no less than 3 years between the girls. So this is called the close in age exemptions. It's also called the Romeo and Juliet clause in laws in some of the Western countries. So this exemptions is given to adolescent who engage in consensual sexual activity. And this allows, there is a reduction in the sentence. When they are booked under POCSO, there is a reduction in sentence, but much needs to be done in this area in the form of law and justice in the POCSO. We don't have amendments yet. Still, the age of consent remains at 18. So coming to the final facet, which is the relationships. Romantic relationships are a very important part of adolescent life. And we can see the ups and downs of the relationships. The left side shows the advantages or the pros of a relationship. Like it teaches life skills, communication, handling emotions, empathy, and they also help in formation of a clear-cut identity, and they also develop a positive self-image. But on the same side, we have some downfalls, like we know about the dating or the intimate partner violence, which is very much prevalent in many of the renowned public schools. And we should also know that the rate at which the the relationships happen, and the same speed the breakups also happen. So all these can lead to mental health issues in the young adolescents. And this is a study that is done in the West, the Toledo Adolescent Relationship Study. It is a cohort study. It is a prospective study that was done in different years. And it was done in adolescent high school students, which reveals that teens who are in dating relationships are not sexually exclusive, which means while in a relationship, they also have sex or casual sex with other partners. So these are all the downsides of having a relationship in the adolescent period. Okay, so now having known the different facets of adolescent sexuality, a quick view of what happens in the different stages of adolescence and what we as adolescent pediatricians should expect, or what is the behavior that we need to expect in these children. Okay, the early adolescence, which ranges from 10 to 13 years, here we all know that puberty is a major change. And we also know that the girls attain the growth around 10 to 13 years and the boys attain 2 to 3 years later. And I'm not going into the details of puberty because it is beyond the scope of the session. But we should know that the onset of changes below 8 years in girls and below 9 in boys is precocious. Similarly, the absence of changes, meaning the absence of thelarchy. If there is no breast development in a girl beyond 13 years, it is a delayed puberty. And in the same way, in boys, if there is no increase in the testicular volume beyond 14 years, it's called delayed puberty. And one point in puberty is that early bloomers, girls and boys who mature early, are in the risk of engaging in early sexual activity and experimentation, teenage pregnancy, and all these things. So we should have this in mind. And sexual curiosity is common, and boys may experience frequent erections, and the girls may have vaginal secretions. And we as pediatricians would have seen like girls in 10, 11 years coming to us and telling that their pants are wet and something like that. So we need to educate them. So this is a normal estrogenic secretion that happens pre-puberty, and we should also teach them the hygiene and things about menstruation. So a quick overview. So what's going on and what you need to expect. So puberty brings rapid growth and changes. So here we can come across body image issues, and there is a constant comparison between the others. We all know that puberty doesn't happen in the same pace in all the adolescents. It happens in different pace. So in the same class, a girl might compare herself. The other girl may be taller than me, and sometimes there is they can feel that their breasts are smaller, the other girl's breasts are, and similarly the boys may also feel that they are taller and they're more muscular. So this is the age or the stage where the body image issues crop in. So we need to address that. So while counseling, we need to ask these questions about body image. And they also have this concern about their body being normal. And when they're getting used to a mature body and new feelings, they develop the sense of modesty or shyness. For example, in our clinic, when we see small children like 6, 7 years, when we want to examine them, we'll undress them. They're okay with it. But once they enter the 10 or 11 years and we want to examine them by undressing, they feel they're a bit hesitant, and they see whether the door is closed or someone else are coming. So this modesty or shyness starts during this early adolescent, and there is an increased need for privacy, and some would have started masturbation, and they're also developing this sense of identity and figuring out who am I. Okay, now coming into the middle adolescence, which ranges from 14 to 16 years. In this age group, the pubertal growth spurt would have almost culminated in menarche for most of the girls. And for the boys also, they've almost reaching their prime period of growth. And in this age, the sexual exploration and experimentation is very much common. And the behavior per se is mostly limited to masturbation, which is seen more in boys than girls, again, due to our socio-cultural factors, and mostly because the society is a patriarchal society. So even the sexual needs are more felt in the boys, and the girls, they actually they have to suppress their sexual feelings and desire. But both the sexes would have started experimenting by we would have seen a group of girls, boys in the middle school. They would have started hugging each other, kissing, touching, and things like that. And sexting also, we should remember. So what do we expect in this stage of middle adolescence? There is an increased interest in being sexually and physically attractive. So in the early stage, we saw that they are being a bit modest or shy. When they reach the middle adolescent, because of the hormonal surge and things, they would like to dress in such a way that they want to be show the girls, they want to show their curves, and the boys want to show their muscles. So they want to be shown as sexually attractive. And this emerging sex drive would have started interest in dating and feelings of love, desire, etc. And they want the parents to be less involved, and peer group is an important influence. Okay, now coming to the late stage, which is the 17 or 19 years, physical growth would have stopped by this period and sexual activity would have begun, but we can't say like every adolescent who comes into the late stage would have started sexual activity. So this depends on various other factors like parenting, cultural values, ethics, beliefs, and I would say media and peer influence are two important factors that influence sexual activity in late adolescence, because we have seen that media can influence the adolescent to any extent, and even pornography. So hence the role of anticipatory guidance is very important, and during the stage talking about sex and contraception is very essential. So what do we expect here? In this stage, the girls and boys that have almost accepted, so they almost reached a stage of growth, and there's a greater sense of acceptance. Okay, so this is my body, this is my height, this is what I have. Okay, let me be grateful. So that is the sense of acceptance that happens at this stage. And in this stage, again, the romantic relationships would have increased number, and girls, they would have that what they want in a relationship. So initially they would be very they would want to present them as attractive and things like that. But in this stage, they would also define the relationship. So what they want in a relationship is very important in this stage, and sexual activity is common. And finally, the identity continues to develop. And we should also know that they should develop their own beliefs. Instead of depending on the peer, they start thinking about themselves. So I think I just gave an overview of adolescent sexuality. These are my references. So now I would like to discuss two cases which I had seen in my adolescent health clinic, and we can discuss it with Dr. Piali ma'am, like how what I said so far, how it fits into this case, and we can have a discussion. Prashant, can I go ahead, or you want to?
Yeah. You're going to introduce ma'am, or should I?
Yeah, you can introduce ma'am. So then I'll start presenting.
So sorry, I thought you would be introducing, but Dr. Piyali Bhattacharya ma'am,
Yes.
she's consultant pediatrician from Sanjay Gandhi Postgraduate. Present affiliation is Sanjay Gandhi Postgraduate Institute of Medical Sciences, Lucknow. She's at present a chairperson of UP AHA, chairperson State AEFI Committee on Immunization, vice president IAP Central Zone in 2023. Oration awarded are 8, and many publications to her name, and she is having almost 30 plus book chapters. With this, we welcome Dr. Piyali Bhattacharya ma'am. And we do have the other expert, Dr. Professor Himabindu Singh. She is the current chairperson, and many achievements to her accolades, like the founder chairperson of AHI Hyderabad, President Indian Academy of Pediatrics Twin City Branch 2013, President Pediatric Academy of Telangana State 2018, President NNF 2008, IAP State Telangana, Executive Board Member Central IAP for 2008, 14 and 15, and 65 plus publications to her merits. So with this, we welcome both the experts also. Thank you. Yeah, please.
Thank you, Prashant. So I will just move on to my first
Just
case.
one thing before you move, Dr. Chaya Prasad ma'am has just shared an article which I just posted in a group. The legal age in Iraq is now 9 years.
Oh,
So Nigeria was 11 as per our knowledge, but now it is Iraq 9 years.
oh, thank you, ma'am, for that. Okay, so this 12-year-old 12-year-old girl. She was brought by her parents with complaints of behavioral changes. Like they said that the mother said that she was like not talking as before, and she wants to keep to herself for the past 6 months. And actually, before this girl came to the clinic, the mother, I happened to know her before, and she had given me a briefing before she brought the child to my clinic. So what she said was, for the past 5 to 6 months in the school, this child has been behaving in a different way. And one day, this mother wanted to check the bag of her daughter, and she found small chits of paper, like small chits, little like flowers or something, like small sentences or words written in it. And one such chit, the sentence read like, "What's the plan for our anniversary?" And this mother got alarmed, and she talked to me over phone, and she told that she'll bring her daughter, and that's how this happened. So this was a early adolescent, a 12-year-old. She was like very small. She's not at lost her innocence, like into the early adolescent. And while doing the head's assessment of this child, so this is a single child, father an industrialist, and the mother works for a private firm, both of them employed, and she's the only child. And she's attached more to the father. And she was also like, she shares things with the mother also, and she's close with the maternal grandparents. So education, she studies in a reputed public school with the IGCSE curriculum, and since her primary years. And every year in this school, there is a thing that there is a shuffle of students from the International Baccalaureate Board to their class. So 6 months back, there was a similar shuffle, and there were many new students who came into her class, and she got friendly with these set of students, like who they're mostly like NRI students from the different parts of the country. And this close proximity led to the change in behavior. And one of the boys from that new set of friends seemed to have proposed to her on Valentine's Day. And she said that she accepted under the influence of her friends. That's what she actually told me. It was the first session. And since then, the boy and these group of friends have been exchanging notes, and this is how it went. And regarding other activities, eating, she takes a balanced diet. Activity, she goes to badminton classes. Drugs, there was no exposure. And suicide and depression, she felt low because during this incident, when the parents found out that this was happening, they confronted her, and there was a lot of scuffle between the parents and the child. And it was when the father raised hands on her, and it was the first time. And this incident made her feel very low. So she said that the mother usually, I mean, sometimes beats her, but the father has never raised hands on her. And sexuality, she hasn't attained menarche. She didn't admit to have any particular sexual desire or feelings. She denied masturbating. She doesn't watch porn. And she said that sometimes she discusses with friends about intimacy. And safety issues. During this recent scuffle, she admitted to having the thought of running away from home. That's what she actually told. Actually, after this incident, the parents have treated her in a very bad way. They said that this is you're too early to do all this, almost like a sinner. And they made her like sleep on the floor in their bedroom, and they didn't properly attend to her. And so all these happened. So that is when she had the thought of running away from home. And screen time, she possesses actually only a Nokia button phone. She actually asked me, so this is the worst thing that can happen to adolescent. And she said that she is having only a Nokia phone. But she uses social media in her mother's phone. And she also uses a laptop. So this child, an early adolescent, was, found in school to have accepted the proposal of a boyfriend and having a new set of friends and leading to a problem in our family at home. So Piali ma'am.
Yes. Yeah.
Ma'am, can you discuss like what is this early adolescent behavior that made her?
See, you've already discussed this before, that in the early adolescence, these children are now becoming, she's 12, on the brink of middle adolescence almost, and she has now become aware of her body, of her sexuality, and it is not abnormal that at this stage, under the influence of peers, they actually enter into such relationships. Now, it is not an abnormal behavior. So, the first thing that we need to do is actually have a counseling session with this child where we should reassure her that she need not fear, she need not feel shameful, she need not be in denial, and that this is part of her growing up. So, assuring the child, and also what we need to do is talk to the parents and make them aware of the normal adolescent development, both the psychosocial, the sexual, all of them, because this is all linked to the child's emotional needs and it being a part of growing up, because they have already manhandled her, they have hit her. So possibly they are not aware that these behaviors are a part of normal growing up. Maybe in our society, we do not take them kindly, but it is a growing society, and in 10 years' time, maybe this will just be part of a normal society. So, the first thing is that reassure the child, be non judgmental, take the child into confidence, and then do a comprehensive heads assessment in this child. Because as we know, the medical part is important, all right. Because if if we can inquire about the sexuality, and if we think she's been in a sexual encounter, which she may be denying, medical examination would reveal any infection, any STIs, any such thing. And of course, a psychosocial one, which will actually reveal the emotional response of this child. Then, of course, we support her in her, educate her about safe dating, about emotional intelligence, about the importance of consent, that when you need to say no, and what about loyal relationships. Then a difference between crush and actually love affair. As she has already told you, she actually was under their peer influence and she said yes to this kind of a relationship. She was not a very interested partner in all this. So she is the right person where we will explain the difference between love and crush, the difference in caring and sharing, and then all this is so important because if you intervene early, the results are also very, very good. Because you need to address that fear in this child, that shame in this child. Now that the father has hit her, she is more ashamed. Oh, what have I done? And that may lead to very inappropriate behavior. She may go in for a suicidal ideation or a suicide itself. And a very important part is supporting the parents in appropriately understanding and appropriately responding to this child, and assess if the child has been sexually sort of active or if there are STIs, etc. So, inclusive, affirmative stance. That is the most important part in this child.
Can
Thank
we
you.
take Dr. M.K.C. Nair's sir's comments or his opinion and his expertise? Say he's here for last few minutes, sir. Very important and such an important topic which is close to your heart and also our heart, sir. Your comments on this case and overall management. Sir,
So
please.
you're muted, sir.
Please unmute.
Good evening. PLE madam has rightly explained in a very scientific manner. What I would like to point out is we should approach this problem just like we approach a medical problem. When you have a presentation of a child or adult with any problem, we think of first, actually, I will think of, that's not a classical teaching. What is the most dangerous thing that can happen? What is the most dangerous? If you miss it, you are in trouble, the child is in trouble. Here, that will be an abuse. So definitely we will look at that possibility from different angle. It may not be easy to ask a child whether you have been abused or not, but you will get lot of telltale evidence, not by examining, even by talking to the child. the language she uses, the gestures she does, and it will be there in her eyes. That is, a psychologist, as a counselor, we should be able to pick up. Examination is for confirmation, but that's sometimes it can be even a traumatic incident for the child. That's the most dangerous one. What is the most common one? Then again, we look at common presentations of, common presentation of a common disease. For example, if somebody comes with a running nose, it's a upper respiratory infection. Similarly, what is the common one? Mild sexual exploration. Okay, has been exposed to media, has been exposed by friends, all that. So there is a confusion in the mind of the child. That's a common one. Unusual presentation of a common one. That's also second thing you have to think of. Unusual presentation. So, for example, for anything previously, we used to think it could be TB. So something has happened in this child. There's some amount of exploration, not self-exploration, by somebody else could have happened. All this will come out if you start talking to the child in a very, very friendly, non-aggressive, and not threatening way. And just keep giving suggestion. Could it have happened like this? Could it be like this? Could it be like this? You never say it has happened. Just putting these suggestions, and somewhere the child will click on the right one, and then you have a starting point. That would be the best approach in this time. No aggression, no straightforward confronting. This is not an age at which a child can be confronted with something, because if nothing has happened, she may be shocked by the whole approach, and that may destroy the trust all over. So that would be my comment.
Thank you, sir. Piali ma'am, like I would like to know whether how is the peer influence important in this child? Like how has it influenced her to do this?
So, Lakshman, this is the stage where peer influence really counts. They start moving away from the parents. For everything, they used to come and say, Amma, Papa. Now they will not speak to Amma, Papa. They will be talking to their friends, gathering information from them. And of course, now it is the technical age of Google and ChatGPT. So they may go on to ChatGPT and Google. But our job is, as Dr. MKC was saying, to explain that a simple date may give rise to a date rape. There may be drugs. So we actually mean to intervene and tell them about safe dating. And if they've gone beyond that, maybe we will have to tell them also about STIs, contraception. So the earlier we catch them, walk the talk before they walk the walk. So that is how we should proceed.
And how do we explain this parents' reaction, ma'am? We all know that it's wrong. It's like a knee-jerk reaction, what they did.
Yeah. So what we tell them is that, look, beta, I understand that you are in a relationship. Just tell me what are your feelings about this relationship? So only then, when we ask an open-ended question, she will come out as to why she is into the relationship. As sir has said, gently guide her through with a few leading questions, saying that, beta, let us know more about this, or how do you feel about this? Are you hurt somewhere? Are you feeling ashamed? So what is your reaction? How is your partner? Is he caring towards you? So things like that will establish what kind of a relationship the child is in. And then we can intervene on those. It's almost like a SWOT analysis, and then we can intervene where there is a little bit of problems, and we can strengthen whatever is the good point.
Can I just
Thank you.
add here, Dr. Lakshmi?
Yes, ma'am. Yes, ma'am.
Actually, the most important, I know, the most important practical thing is first we need to be comfortable. The parents also, all the whole atmosphere need to be very comfortable instead of feeling shocked. The parents also get very upset. And in that situation, it's very difficult to open up. So we need to really make the things comfortable, make it demystify, destigmatize, whatever it is, make it the thing, whole atmosphere cool, comfortable. It's okay. It's okay. Jo ho gaya, now what we can do. And if you can make the things very comfortable for the child to open up, the parents also can come down on their emotion. Then we can have some logical, we can have some discussion how to move forward and help the child, both as parents and as doctors. I think the important thing is that, that shame, feeling of guilt, all those things, big judgmental, all that is so much extremely prevalent. And that is the main fear our adolescents also have. So I think that we need to help the situation that way. Maybe just a small.
Yes.
There.
Thank you, ma'am. So that's what I did with the child. I had a separate discussion for the parents. I had arranged for a Zoom discussion and counsel them regarding this. And during the second session, the child was quite comfortable. And at the end of the second session, actually, she asked me when leaving, ma'am, like you were talking about certain things. May I know what is sex? So that's what she asked me when leaving after the second session. So I told her, like, maybe I will talk about this in the next session. So I think the anticipatory guidance part, which already all the experts have told, is very important in this case. Shall I move on to the next case, ma'am, as we are
Before
running
you
short?
move on, MKC sir, there is one question, two questions for you. One is how to make parents accept this as a normal thing. And as the girl is still not minarchy, should the anticipatory guidance regarding that also should be given to a girl? This is from Dr. P. Lal. Yeah.
Just I'll answer one by one. First one is how to make parents accept. Now let me tell you, the topmost neurosurgeon in India had his grandchild, Down syndrome diagnosed. At that point of time, nobody has seen a better neurologist or neurosurgeon, but he could not accept that the grandchild has Down syndrome. So let us see, if we are parent, we do not accept any of this. We talk about it for other people. It is so simple, very sensible, very, easy for other people. But when it happens to you, parents won't accept. First, you accept that you as a parent also may not accept. I can understand your difficulty in accepting certain situations. Once you approach that way, I am also, if I was in your place, even I would have been in a dilemma that after so many years of counseling experience. So that put the parent in a very positive frame of mind to accept even the worst. This is very important. And never break it like that. Just keep asking them, in your time, what all things used to happen. Is it same? Times have changed. Is it the way, how do you behave with your grandfather? Is it the way you behave with your grandfather? Is it the way the child will behave? The second point is change of time has brought many abnormal as normal. And the third point would be that whatever happens, you have to do in the best interest of the child. And what is in the best interest? We are not here to prove something is right, something is wrong. You are here to protect the child. If you don't do that, you are not a parent. So whatever be the thing, let it be very, very, very bad. So what? You as the blood flows in her, veins is same as your blood. So nobody else in this world can be as concerned as protective as you can be. So once you tell these things, I think most of the parents will come around. Not that they will accept easily, but even if they reject outside, in the heart of heart, they slowly start accepting. That would be a simple technique. What is the second question? I forgot.
The second question, as the girl is still not minarchy, when the guidance should be given to her?
Okay,
Lakshmi.
menarche guidance that is more simple. There's no complicated. It's much more medical. See, the point is, if the girl is BMI is very low, or at least in simple words, if you say she is not there, I'll just give you an example. There was a girl who was 15 or something and didn't have any, menarche. What do? You just examine the child, not necessarily stripping the whole thing, but you can make out other thing. Whether she has breast development, pubic hair development. Actually, if she has all that, maybe even one more year you can wait. This particular child had said, next 2 months you are going to have all holidays. Why don't you eat a lot? And she said she's very fond of rice and fish. I said, eat. Instead of 3 times, eat 6 times a day. You eat well. Your malnourishment will go away and your menses will come back. Sure enough, After a month or two, the mother called me and said she has menses. That's a simple thing. Yeah.
Fine, sir. So Lakshmi, I think
Yeah.
if there are no other questions, but before moving on to the second case, as sir has said, he may leave. So Dr. Chaya Prasad has asked one question in chat for you only, MKC sir. That is
Yeah.
for gender dysphoria. She is asking, as per DSM-5, it refers to the distress that accompanies the incongruence between one's experience or expressed gender and one assigned gender. Is it different from the gender reassignment? And how can one decide it is gender dysphoria? Please, sir, if you can.
Let me tell you, if there are 5 experts, there will be 10 answers to this. It's a some completely little bit confused area. But in a simple way, if you say, if when you are born, you are assigned a male or female sex. Most of it. No, intersex and all won't come. And you have grown up with that. Suddenly, when your mind start behaving different from that, that is where you call incongruence. The DSM has given the diagnosis without taking into consideration all the uncertainties that can happen. They have taken a principled stand that just like if you are a psychiatric patient, your thinking, feeling, and action don't match. So there is incongruence. Similarly, here the assigned sex for you and the actual feeling that is coming in your mind, if they doesn't match, then there is what is called incongruence. There are many other terms. If you start explaining that, the whole thing will be more confused. I think let us stop it here.
Sure, sir. Yeah. Lakshmi, please.
Yeah, so I just rushed through the second case with want of time. So 1 minute. So this is a 17-year-old girl who was brought again with the same complaints of like feeling lonely and keeping to herself. And her parents feel that once she was a very lively child, she's lost her liveliness and doesn't find interest in things that she used to enjoy earlier. She's the second born of educated parents, and her elder brother is pursuing physiotherapy. Father is a businessman, and her mother used to work now, but she takes care of the home. She's not much attached to her brother. In school, she's a public school student, and she goes to school by bus. She's an introvert by nature and doesn't have much friends. She does well in academics and aspires to be an engineer. And she said some of her classmates started linking her with a boy in her class. She used to talk to him, but she admits that she doesn't have feelings for him. And once during her birthday, this boy had gifted her in the sense he gave her a small a pen, a pencil, a very uh, minor gift. And then after giving the gift, he told her that I just gave you to tease you. And this incident hurt her to such an extent that she was very much affected and she felt very low. What she told to me actually was she actually uh, she she likes to have some gifts on her birthday, but she's not friends with many of them. She's an introvert. And when this boy happened to give her the gift, she felt so happy. And after that, when he told this and teased her, that made her very much affected. And not much in eating and activities and other things. In suicide and depression, she feels low most of the time after this incident, and she doesn't like to share her feelings to anyone. Sexuality, she's attracted to the opposite sex but doesn't have feelings for anyone. She denied masturbating. Safety, she's aware of her boundaries and safety measures. Screen time, she spends about 1 to 2 hours on non-academic activities, and she denied watching porn. So, Piali ma'am. So
Yes,
this is
Lakshmi, beautifully presented case. So,
another case of relationship issue which we come across more commonly nowadays.
correct.
What is your
So, as I was saying, when we reassure them, we should take care of their feelings also. And like we teach children about coping skills, these children have to learn about coping in relationships also, about breakups, about failures, about teasing, about violence, as MKC sir was saying. So, we need to ask them to learn about these coping skills also. It's all right, as sir said, we need to reassure, we need to say it's all right. let's find out. See, this child that you have explained is a 17-year-old with a positive body image initially, but anhedonia is something that you have said, that she is having loneliness, she is not doing her regular activities, she's almost hiding herself in a corner. So that gives rise to a cause of alarm over here in this child. And what we need to see is that she is feeling so ashamed or so hurt that she may go into a suicidal ideation or attempt a suicide. So this child cannot be left alone. She has to have counseling, and we need to reassure her and build back her confidence and coping skills. So this child will need a lot of parental support, will need support from her doctor pediatrician, will also need support from the school authorities. So we cannot leave this child alone as it is. MKC sir, anything more you want to add, sir?
Really, madam has said the key points very nicely. I like to push it little further and say, none of us are really competent to really see the relationship issue. If it is suicide attempt, we have a package, how to go about it. If it is something else, we have a package. The only book available on relationship is that your personal life. Just think of, I started child guidance like that. When a child comes with a problem, I imagine myself in that knicker, not pants. And what did it go through my mind? I know this must be the same thing going through the child. I give you a simple example. When I was by about 18, maybe 18, second year of our life, I did in CMC Ludhiana, you know that. So we have a party for the freshers, first year children coming. Second years and first years, we have an evening dance party. And one purposefully, some person, paired me with a girl who happened to be same caste. You understood? And somehow, not that she was so attractive or something, but somehow at the end of the day, her friends, 3, 4, kept on saying that I proposed to her and she refused. Now, this is not a big thing. I know everybody laugh at it, but for me, that was the biggest insult in life. I didn't know what to do. I was in very bad shape. Not, of course, suicide, because I'll never do that. Got a point. So one of my classmate girl came to me and said, why are you spoiling your first year examination? You come with me in the campus. Next 1 week, we'll go hand in hand. Okay, she was holding my hand like this. I was putting this thing, walking around. So what happened? Everybody started saying it must have been the other way around, and she is making noise. And that's one thing is the best counseling I have ever had in my life. So much so, 45 years down the line, she is the best friend of my wife. She is in US now. We are still friends. I still remember the good things she did at that time, just to boost up my image. So I think we need to think of not exactly the scientific way alone. There may be other option how to support the child. If only we understand how much pain that child is going through. That's all what is said.
Thank you, sir.
Exactly, sir. So this child actually started to cry when narrating that incident. She was very much upset by it. Piali ma'am, we saw that she was a good badminton player. So how do we channel these kids' energy, like while counseling them? How do we
So
channel their
as I
good
said,
energy?
Lakshmi, we do when we are doing a heads, we are also doing a SWOT analysis, finding out what are the strengths of the child and then channelizing her into those strengths. Like in this child, she's fond of sports. So fine. If she's fond of sports, we will channel her into sports. We'll ask her how many hours she's playing, or if she likes it, where in the sports field would she like to see her in 5 years' time, whether she is doing her studies in an adequate manner, whether she's getting her night's good sleep. So these are more important. And as MKC sir was saying, nutrition, that is one part. We need to talk to her about nutrition, about the importance if she wants to become a sportswoman, why she should not have anemia, why she should eat good food, about the growth spurt, about the body development, everything at that period of 16, 17, we may have another growth spurt also. So we need to tell her about the importance of nutrition, about how sports means more than just sports. It means developing so many other qualities, maybe leadership quality, maybe staying with others, maybe managing failures. It teaches so many life skills. So we can actually channelize her towards the sport, and the nutrition and her feeling of coping would improve with that.
Thank you, ma'am. So this child, since she had anhedonia, I just screened her with the PHQ 9 and she scored under the mild category. And so like how often do we call her back for follow-up, like every 1 month or so, to see whether she has recovered from her symptoms?
So Lakshmi, not one session will do in her. This child needs very close monitoring. Tell the parents not to leave her alone, and please ask her what is her suitable time when she would like to come back, possibly maybe in a week's or in a fortnight's time. And you cannot close the session in one session only. You may need 5 to 6 sessions for proper reassurance of the child. Till you have stabilized the child, you don't let the child go.
Okay.
And you can also partner with a psychologist or a psychiatrist and help assess, and she can get more help from that. Please don't let the child go. Be there as her support, as her back, hold her back, keep her with you, but then see that she is assessed with the psychiatrist as well.
Thank you. Thank you so much, ma'am. As I've already told about the anticipatory guidance also for this child, would you want to add anything else, or Hima,
No,
ma'am?
I think Hima can add if she wants to. Hima?
Uh, yeah, I think that's well said. And all these cases, it's every case is a challenge. Every case may be a new experience how to deal with. So very broad guidelines and suggestions we are giving depending on our experience. But you may find, I know it may take time. It's not that, as already told by Dr. Viali, these things take a lot of time, and convincing the parent, the child, and getting her out and channelizing energy into other things, coping up skills, all this requires time. And we require, I think, the trust they develop in us, and that space, safe space, non-judgmental atmosphere helps a lot. So
One
that
thing,
will be quite
Lakshmi, I would
healing.
say
Yes,
is
ma'am.
that if she has anybody amongst her family for support, like she loves a masi or an elder sister or a cousin, you should actually include her or involve her during her therapy
Yes.
and tell her that she needs to be in close conversation with this child so that she can express, she can ventilate, and she can look for reassurance in that elder person or the friend or the family support or whatever you would call it.
But unfortunately, this girl, she didn't have any close friend whom she can open up to when she wanted to share. Being an introvert,
That's the
she didn't
problem.
have that friend part, so that was missing. So I advised her to find someone who matches her wavelength, find some friend or a trusted adult to share her feelings. That's what I told her.
Actually,
Thank you.
sometimes, sometimes the children, it is a reverse also, they sometimes open up and they want only the friends and they don't want their parents along with them, especially in situations related to sexuality. So, ye bhi hota hai. So, we somehow have to get that parents on board, because that is also a difficulty we may face. But we need to really work out with the child that, as sir has rightly said, MKC Nair sir, that the parents are after all there to protect you, and they definitely will care for you, and that aspect will get in, so we can get them parents also on board. But I found one case, they don't want the parents at all in that scene, and they feel they don't understand them well properly, all those things. So I think we have to find ways to do that and convince them.
Thank you, ma'am. Thank you, Piyali ma'am. Thank you, Nair sir, for all the valuable inputs. So we move on to the next part of the session. Prashant.
Thank you so much for being on time. Dot 1 hour and one case has been finished. Now for the second hour, 4 to 5, we'll having a second case that will be presented by Dr. Sneha Gadkar. She is a director and consultant at Ankur Bal Chikitsalay, Gwalior, MP, a secretary of Gwalior Academy of Pediatrics for 2011, treasurer of Gwalior Academy of Pediatrics for 2004, 5 and 14, a national treasurer of Adolescent Health Academy for the year 2024 and 25, and secretary of MP State Conference in 2021. Along with that, she is active instructor of ALS, BLS, and NRP. So welcome, ma'am, and please proceed with your presentations. Thank you, ma'am.
Please unmute Dr. Sneha. Full screen.
Good afternoon, everybody. And after a very good session by Dr. Lakshmi, I will be taking up on the teenage pregnancy. Just she has talked too much about sexuality, but I want to add one line that sexuality is a fundamental quality of human life, important for health, helps in individual development for the preservation of human race. Like hunger, sleep, maturation and defecation, there is an urge which cannot be ignored. Parents, they train their children for toilet training. Similarly, they should train and educate for the sexuality also. Failing which will end up in the problems like teenage pregnancy. WHO defines teenage pregnancy as pregnancy in young women aged 10 to 19 years. Though the global adolescent birth rate has decreased by 23.1 million birth per thousand women over the past 2 decades, low and middle income countries still have around the 21 million of adolescent pregnancy annually. The leading cause of mortality among the adolescent girls is the pregnancy and childbirth related complications. Reducing adolescent fertility is an essential step in meeting sexual and reproductive health targets of the global significance. According to 2025 UNFPA report, India has a high adolescent fertility rate of 14.1%. The proportion of adolescent maternal death to total maternal death remains high. It is about 10%. And despite of substantial decrease in the maternal mortality in last 2 decades, the adolescent maternal death contributes 10% of total MMR. These are the global data which indicate the percentage of the delivery by 18 years of age. And India falls in 20 to 29%. It is an old data that recently in 2 decades it has decreased. These are also certain figures from the Asia where it shows that there is a high prevalence of childbirth before 18 years of age. Now, what are the challenges we are going to face with that? According to NHFS, 14.7% of urban and 27% of rural women in India get married before the age of 18, and another 40% get married soon after they attain 18 years of age. 3.8% of urban and 7.9% of rural women aged 15 to 9 years are mothers. So what are the determinants of teenage pregnancy? There are so many determinants like cultural, social, economical. So we'll take the cultural determinants first. Education, there should be 100% right of education to the all gender, especially for the girls, because education leads wiseliness and it postpones the things. Poverty is the second cause. In the lower socioeconomic class, the children, they want to get married in lieu of decreasing their expenses. And similarly, a poor person in clearing the debt and for getting the jobs, it is being sexually exploited. Maybe the males also, not only the females are exploited, for the poor people, males are also exploited. In villages, the cultural and religious beliefs are there that the girl should get married. Either she attains menarche or even before that. So the early marriages are prevalent. In higher socioeconomic class, because of the poor family connect and the poor interpersonal relationship, the girls, they go for experimentation and go for the sexual experimentation. In this era of the digital media, there is too much of peer pressure and experimentation is there. So they want to explore the sex. Commercial sex workers are very, very careful for not getting pregnant, but accidents tend to happen. And this, as a result of rape or sexual violence. Now, the socio-economic determinants are there. That is because of the limited understanding of pregnancy, intercourse, and abortion. It leads to unwanted pregnancies, sexual health complications, and delays in the abortion. Nowadays, the people say that the social media is the first place where the information can be taken. So knowledge of sexual intercourse, pregnancy, contraception, HIV/AIDS, the children or adolescent try to get from there, which is totally inadequate, inappropriate, and it so many times it is misleading too. Socioeconomic status in this is a chain that the low socioeconomic status leads to adolescent pregnancy. In turn, it leads to less chances of employment and again low socioeconomic status. Comparing to rural and urban, the rural adolescents are not having much knowledge about the sex, so they land up in the teenage pregnancy. If a boy or girl is involved in sexual activity before 18 years of age, they come under POCSO Act even if they are married. There are certain potential risk factors for the teenage pregnancy. Like if there is unhealthy environment at home, there is lack of support, person may get stress and depression, going for early dating behavior, lack of contraceptive use, having a high risk behavior using alcohol and drugs. Financial constraints are also there, exposure to domestic and sexual violence, and there are certain delinquency or criminal behavior. Like so many times we read in the newspaper that a girl was playing in a marriage hall, somebody took her, had raped and murdered her. So these are all criminal minds and criminal behavior, which is so many times under the influence of alcohol. What are the consequences of the teenage pregnancy? Consequences are for maternal, for baby, and for the community also. There are consequences for the health, education, economic, emotional, and social changes. As far as health is concerned, the adolescent teen pregnant, they hardly go for preconception care. They don't go for antenatal care. Their nutritional status is not seen. They are having poor nutritional status. Their body structure is not so to carry the baby, and they'll end up in the difficult labor. The mortality is also due is illegal abortions. There is chronic pelvic pain, cervical cancer is also common, and STI and HIV. It has been seen that the teenage pregnancy has gone down, but the rate of STI has gone up in the last 2 decades because of the sexual experimentation. Because of pregnancy and delivery, there is dropout of the school and the college, and they are unable to continue their education. This disruption of education limits future economic opportunities to the mother. These emotional and social changes, they are mainly with the unmarried teens, where they feel isolation is there, guilt is there, stress is there, depression, there is low self-esteem, lack of interest in the studies, lack of support group, and lack of job opportunities. For the baby, the prematurity, low birth weight baby, birth asphyxia, septicemia, poor emotional bonding, poor social acceptance if the unmarried mother is there, and both of them can have some behavioral changes. And for the society, there is burden of increased MMR, NMR due to lack of antenatal care, unsafe delivery, and poor neonatal care. And they are economic burden for the society because they cannot earn. What is the prevention? We always say that prevention is better than the cure. So, what are the preventive measures which can be taken to avoid the teen pregnancy? That can be at the family level, can be education, can be on the healthcare, and can be at the community level. So, family level, open conversation between the parents and teens about the sexuality, morals, and values of life. I think it forms a real base for a adolescent's future. If the family is strong, their morals are good, I think they don't end up in any problem. For adolescent, the most, again, second most important thing is comprehensive sex education, which is the need of the hour now, and it has to be seen very fast and earliest. Preconception care, prevention of sexually transmitted infection. Here again, I want to highlight that they are on the rise and they have to be taken care and told how to prevent the STIs and HIV. For the adolescent, goal setting, confidence building, and education programs which can promote the healthy relationship. It may improve the skills and skills related to partner negotiation and sexual refusal. This can be taught to them. As far as the healthcare is concerned, this is again, they should get and ensure affordable and confidential reproductive healthcare system. Since adolescent, they don't have much money and they are very shy in counseling and going to a doctor. So they should have a trusted place where they can go and get the advice. Access to contraception and postcoital pills and safe abortion. These things should be available to them, and to ensure the prenatal and postnatal care in case pregnancy advances. Now, the prevention at the community level is preventing child marriages, equal education right to girl child, laws to prevent marriage before 18 years, responding to the needs and rights of the married woman, community engagement like supportive environment that provides guidance and mentorship. Support for teen mothers, mental health counseling, education continuation program, alternate schools till daycare support is there. Then teen pregnancy prevention programs, prevention of STIs, and financial and social support services, providing a job and care for the children. That should be the strategy at the community level to prevent the teen pregnancy. Thank you.
Good, Dr. Sneha, you have covered the important aspects of teenage pregnancy, but would you really like to go through a case? Really discuss the practical.
Yes.
Yeah.
I have selected a case from a village girl.
Okay.
It's a Gauri, 18-year-old female staying in a village. She got married after 10th class due to family traditions and customs and got pregnant
So
soon after the
village?
marriage within 2 months.
Sneha, which village? Where? Which part of? Which state?
Madam, village, here is this very small place called Shopur
Okay.
in MP.
In Madhya Pradesh. Okay.
Madhya Pradesh.
Okay.
MP, it's a very small place where the health facilities are also not much available. So going to the head's assessment, she is staying in a village Shopur, which is there in the MP. It is 100 kilometers away from Shivpuri. The father and mother both are uneducated. They are farmers by profession. She has 3 younger sisters, eldest one with low socioeconomic status. There is hardly any privacy in the house and all living together in the 2 rooms. She attended school in the village up to 10th standard. Parents did not allow to go out of the village for the higher studies and there was dropout after the class 10th. Her eating habits is the vegetarian. She is not active on the social media, not socially active, loves painting and singing, knows cooking and farming. She doesn't take any drug. Sexuality, she attended menarche at 13 years of age. Periods are regular, not aware about the sexual life, and she was not aware that physical intimacy may lead to pregnancy. Suicide and depression, she is feeling lonely because she is not open to any family member in her in-laws' house, and yet even to husband also to express her feelings. As far as safety is concerned, she is scared of her safety if she discloses her unwillingness to continue pregnancy at such an early age and stage of marriage. Should I ask question, Dr. Hemabindu Madam?
Yeah.
Does comprehensive sex education is essential in school age in order to prevent the early pregnancy?
Yeah, I think good case. I think most of our teenagers in rural areas, even in the urban, I should say, they're not exposed to a comprehensive sex education. So this is the problem. Most of them, as you rightly said in this case, she was not exposed to any education or any knowledge about her body parts. Neither she doesn't know what is intercourse, I'm sure, and how this will lead to pregnancy. She was not aware. So this is, sometimes we give only part knowledge. Maybe they know about their body parts. They know that after the menses start, that we start giving them knowledge about कि ये महीना महीना होगा and what कैसे clean रखना है, what to do during those 5 days. All that we give them knowledge, mostly through mother or somebody. But then a comprehensive knowledge is not given why it is happening. Why do these menstrual cycles happen? कि वो ovulation होता है and there are ovaries in your body. Now you have become active, your body, this reproductive system is now active and you can become pregnant. So if you get exposed to sperms which are there in the the opposite partner. So this knowledge is not given at all. Even in my own experience, when in my Yuva Center in Nilofa Hospital, I had number of cases, at least I say teenage pregnancies about 12, 13 years, 14 years. When they become pregnant, there's a hue and cry, even it's married or unmarried. This is the marriage wala cheez hai. Even unmarried has become even more, difficult when they just come and say that I didn't know that this physical intimacy leads to pregnancy. So this is what I think we should need to give this knowledge to all the young people and in order to prevent pregnancy. So there are two things here. One is in order to know what is the consequences of this intimacy, not just pregnancy, STI, HIV, other things are also there. And we also have to know the legal point that they cannot have sex up to 18 years. And then with marriage, we are thinking it's legal, but it comes under the POCSO. So all this knowledge has to be given. Absolutely comprehensive sexual education is absolutely essential in the school age itself, because they're all in the school age, when they're 9th and 10th, they're already 14, 15, they're attained menarche and they can become pregnant and they can get into experimentation. They start exploring, the hormones are kicking, there are attractions happening to them. We cannot just say कि ये नहीं करना है. We also have to tell them how to deal with those feelings, those attractions, and how when the physical intimacy के बारे में also we need to tell them, because if you don't tell them, they know that they will actually go through media, or they may be just not knowing anything. And then in this case, there was a family compulsion for she got married, isn't it, Sneha?
Yes, yes,
Yeah.
yes, yes,
So
yes.
what is the reasons? What is the culture? What did you say that in this
Madam,
tradition?
down the line, three more girls were there in the family. So they
Hmm.
want to get the eldest girl married at the earliest stage, so that they will have they will unload financial burden.
Yeah.
And then again down the line, they have to marry three more girls. So that is the
Yeah.
compulsion for them.
So that is a pathetic state that they feel most in some communities, especially the girl in this rural population, they feel that she is not our, no, ghar ki nahi hai,
Yes,
parai
they
dhan hai,
just
all those things are there.
want
So
to
they
get
feel
rid of.
they just wait. When she attains menarche, they start announcing within the family or within the community that she is now attained menarche. They also celebrate in certain communities, and then it is a way to tell that she is now ready for marriage. So that is the only thing they have in mind, instead of just educating her and completing her basic education and making her independent so that she develops her own skills to make a good decision about her own life, selecting a life partner, how she wants to live beyond that. So unka, instead of making her, develop in that way as a personality, the family looks at her as, to just give her away, finish their responsibility with marriage. To end with marriage, they feel their responsibilities ended. So that is very sorry state. So we need to really have to make the girls very strong either, or we make the communities aware. It will take a lot of time. It has been decades now. We are still, grappling with this teenage pregnancies happening. We have to come down on this. There's a global call that we have to, bring down our teenage pregnancies in India. So we have to join hands with this global call. A number of actions are required. Multi-pronged actions are required. One is which is the comprehensive sexuality education to all the girls and boys, and making the community aware that it is not legal to get them married before 18. Instead, focus on the girl child education and make her fully independent personality and make her self-sufficient so that she can be, part of that decision making to select a partner. I think this is required. So This is no doubt that this
Can I
is a
come in, Hima?
comprehensive
Can I
sexual
can I speak,
Yes,
Hima?
Pyali. Yes, Pyali.
Yeah.
Yes,
So
yes,
Sneha,
definitely.
there is another aspect to this.
Yes.
Because I am telling you a real life situation. My maid comes from the village. And
Okay.
she has married off her daughter at 16. And when I said, what have you done? Why have you married this girl at 16? She says, Didi, nahi to kisi ke saath bhag jayegi. So
Yes.
promiscuity
Yes,
is
I
not
see.
unknown in the lower society.
Yes.
So the to prevent anything from happening to the daughter, she has married her off early. So there are that aspect also.
Yes,
So
yes.
like Hima has said, we need to strengthen them, but then for these people, we need to explain safe sex. We need
Yes.
to explain contraceptives. We need to give them full knowledge of their body. So that is how we can support these girls.
Actually, yeah, that's what I said. Multiple reasons. Our Indian culture, why the girls are getting married at that age. So
Early.
one thing is they're very early. So they
Dr.
have their own
Himabindu,
expectation families. Yes, sir.
I have to leave now.
Ah,
So
yeah,
I
please.
just
Oh,
make
yes, sir. Your
one
comment,
comment
sir.
before
Yeah,
leave.
please, sir. Please, sir. Please, sir.
Yeah, three issues we need to discuss. One, the majority of teenage pregnancy is married pregnancy. For whatever reason we are
আমি একটা
discussing.
webinare আছি, আমি পরে কথা
That
বলছি।
is what we
Yeah,
have been discussing,
mute,
the
mute.
reason. Number two, even if we are saying about sex education is not a right word, if we can use either sexuality education or family life education. Sex education, whatever happens, it will going to put negative feelings in the mind. And the third one is, does the sex education help the child or not? We have evidence for that. In a PhD study, one of my gynecologists who are done with me clearly showed that if you a child who doesn't have sex education or sexuality education have 5 times more chance of getting teenage pregnancy. Odds ratio is 5. That is 5 times more chance. If the parents are mentally separated, not physically, 7 times more chance. And if the parental guidance is poor, either too strict or completely loose, there are 9 times more chance. Just remember, if the parenting is loose, 9 times more chance of getting pregnant. If they are mentally separated, not even physically, 7 times more. And if they don't have a sexuality education, 5 times more. 9, 7, 5. If you remember that, this will be the best part to remember. Unmarried pregnancy. Married pregnancy can only be prevented by keeping all the Beti Bachao program, whatever you are saying. Beti Padhao, Beti Bachao. The moment there is education, and Kerala, northern part of Kerala has shown that the moment the girls have the education, their marriage age really goes up like anything. Thank you, madam. I have to leave.
Yeah,
Sorry.
thank you.
Yeah.
Thank you, sir. Thank you.
Sir, thank you very much
Yeah.
for your
So
valuable
any more
comments.
inputs, sir, from your side? Because we can anyway continue, but your inputs are very, 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 very pearls of wisdom from your side. Anything else you would like to add for this session, sir, before you leave?
No, I think it has gone very well, madam. You have conducted it so well. No problem. Okay.
Thank you, Nair, sir.
Goodbye. Good night.
Okay, good night.
Thank you,
Take
sir.
care, sir. Thank
Thank
you.
you, sir.
So, yeah, so we were discussing there are multiple factors for marriage in our Indian traditional systems. One is that Dr. Pial has mentioned that they look at the child as just because safety issues also, and they feel that jaldi se shadi karna better hai. And this is therefore we have to the whole how to make her safe and self-reliant. Again, it is a very, very big, very big community awareness issue. The community has to be safe. It is not completely like, only one associate, one organization you and me can do. It will take time. But meantime, we have to focus on the girl and the family. So like allow her to first, she's safe in the school, at least. She's safe in the college. So usko padhai complete karne ke liye kam se kam we have to encourage that and push that. If you push girl child education, at least that most of our issues will come down. Ultimately, the marriage rate will come down. At least it will be postponed, and even the pregnancy rates will come down. I think this is very much doable. So Sneha, this is very much essential, and we have to push. As AHA is also trying to push the comprehensive sexuality education through our chapter.
Thank
Yes.
you, madam. Thank you very much. One more thing I want to add. that even we cannot change the culture and tradition very fast, but at least by imparting knowledge to them, they can increase the delivery. They can postpone their delivery and pregnancy till they become mature.
Of course.
So that much knowledge we
Yes.
can impart them at the time of marriage or before marriage by comprehensive sex education.
Yes, yes. We can ask them, we can actually tell them कि उनके family में, see what happens when the child is born. So जैसे they would have seen in and around in the neighborhood how much the mother has to take care of the child, nurture the child, breastfeed the child, take care of the child. Are you ready for it? So we can ask this question. So this is the real life. Look around, not in the movies, not in some fantasies. Look around. We have children in your community, बस्ती में दिखेंगे तो उनको कितना टाइम लगता है, कितना देखभाल करना पड़ता है, ये सब आप रेडी हैं क्या सबके लिए? So ultimately when you pose these questions, so they are not ready. So then if they're not, then how to postpone? We can get that conversation slowly, and we can say that you have to make a decision. We'll help you. All those things which we have discussed earlier. Yeah. So
Thank you, madam. Can we take one more question?
yeah, please. I think
The next question is, what is preconception care? Like teenage marriages are there. So can we stress them for preconception care once they are married?
Definitely. Yeah, I think this is one of my favorite, one of the programs which I'm trying to drive. See, we plan everything for everything in life. है So even for every small task in life, we plan. And why not for parenting? When you want to have a child, when you want to conceive a child, it is you're creating life which is going to come into this world. So we need to have a proper planning and care for that. So what do you call a preconception care? It is nothing but before you conceive, the care has to be taken by both the girl and the boy or both the partners. So whether it's within marriage or we are not attaching marriage to it, but if it is definitely a married conception, the social issues will come down. But this is another topic for discussion. But medically, like as technical experts, we would like to definitely push that. Please plan for every conception. It should be a wanted pregnancy. First of all, let it be wanted, let it be planned, and it should be planned at least 4 months before. There are a lot of interventions to do. So we are looking at the overall girl child, her health, because she is going to be the mother, and the baby is going to be conceived in her womb and taken care for the 9 months, and later the 1,000 days of life. The child is nurtured by both the parents. So it is important for both of them, the father and the boy and the girl. It's not only for the girl. Both the boy and girl has to take care of the nutrition, the body mass index, the weight, how much their BMI they have, and what is their the other nutritional status like anemia. We know that most of the anemia incidence is quite high, so we don't want them to get pregnant when they're anemic. So we have to take care of their anemia, that prevent anemia, treat anemia if it is there, and other micronutrient deficiencies also. We have to supplement them with good micronutrients, including folic acid. That is one of the most important micronutrient which has to be started at least 3 to 4 months before we can start, or around the reproductive age. I think it's better too, because they explore. Most of the teenagers explore, and when they are planning conception, we don't want them to come at 6 weeks after missed period and say I'm pregnant, and most of the crucial period of embryogenesis is over. The neural defects, this have to be prevented. We need to ask them to take micronutrients before that, before conception. So not only this, they have to also look at their obstetric history. So if they have a bad obstetric history, abortions, etc., they need to take care of those issues also. Meet a gynecologist, take care of all the obstetric problems they have. That has to be taken care of. And also they have to be eumetabolic. So काफी लोग है ना, when they can have hypertension, diabetes, gestational diabetes comes in. So there is a family history, especially when there's a family history. They have to check whether they are already having these problems. If so, they have to get them rectified, including thyroid levels. They also have to look for whether they're having carriers of any genetic disorders. So some of the genetic problems are running in the families. So if they are carrying those genes, they can prevent them to go to the next generation by selecting the partner. So that should be one important criteria also, that we don't want the genetic disorder. We don't have any proper treatment for that. So instead of getting them come into the world with genetic problems, it's better to prevent. So this all comes under preconception care, including having a healthy lifestyle and a good support system. So need to when they need to be financially independent so that they take care of the baby which is going to become in their life. So they need to be financially sound, good family background, a support, and the husband wife, the partner inter-partner relationship should also be there, very good caring sharing type of relationship. And they should seek help if they have any mental health issue beforehand. They should not feel shy, and metabolically good active lifestyle, and all that yoga, meditation, um, all that is all a package of care. This has to be really, we need to do advocacy regarding this through our IAP, or even Foxy can take up this. And this is extremely essential in India. So most of our pregnancies are quite unplanned. They suddenly come and give us news ki bhai main to pregnant too, and the whole family celebrates. But we need to actually talk to them that is kavi thoda sa preconception care clinics also should come, which may be far. It takes some time for all this, but I think it should come where every conception is planned. This Neha, I hope we can do that through our organization.
Thank you, madam. They say that the neurodevelopmental progress starts right from the second week of the preconception. So if you want your child to be a brilliant, a good, so you should take care from the for the baby preconception, so that
Yes.
the day begins, they will start getting a good nutrition and good development from the womb itself.
I think I want to stress on the role of the father also, the would-be father. It is not only for the girls, the boys, the would-be fathers also to take care of their diet. No alcoholism, no, even a bit of alcohol taken during that period can impact their quality of the sperm. So the DNA, the sperm quality can be affected by exposure to substances like smoking, alcohol, and any drugs they take during that time. Even for the, and also, this radiation, pesticides, environmental problems, even your mobile phone, we always keep in the pocket. So we need to take care of reducing this radiation exposure, pesticide exposure, environmental exposure. The boys also have to take care. So this is what we need to tell the father. And even there's a relation, a lot of research is happening in this field. There is a relation between the diet of the father, mother, to the, how the impact on the genes of the sperm and the egg, and in later on the embryo. So there is a lot of evidence coming in. So we have to be careful about our diets also during that time.
Thank you, madam. Piyali, madam, do you want to add anything in that? Please
Unmute,
unmute.
Piyali.
Please unmute.
Neha, I just wanted to know what was done in this child actually. What action did you take?
Madam,
What
action.
happened? What happened to this child?
No, preconception care, because she got pregnant. So we
Ah.
want to know about the what is she could not take preconception care. So there is any role of preconception care?
How did you deal with her? What happened to her? That is what I wonder.
No,
What was
there was no question of dealing. She got pregnant. She had to continue with her pregnancy because she was married girl and she was 18 years old, and the marriage was consensual with the all family members. So we can go give good antenatal care now. That is the only thing which we can do.
Yeah. So we have already lost the opportunity to give the preconception care.
Yeah.
And for this couple, and now she's pregnant already. So what is the best thing we can do is take care of her and take care of her unborn child during pregnancy, and so that there can be high risk problems during this teenage pregnancy. We all know that. So we have to screen for her during the good antenatal checkups, and take care that during her whole pregnancy period, she takes proper nutrition, the micronutrients, and screen for other, high risk problems like hypertension, etc. And we have to plan delivery, how it will happen, whether there's a CPD, whether it's a normal, or what other problems can happen. She requires a close observation.
So this is a comprehensive actually thing where she has fear and she doesn't know much about pregnancy or about, I don't know, she may be feeling that it's a violation of her body. So maybe the obstetric care, the pediatrician's assurance, and a psychologist's care as well maybe a social worker or an Anganwadi Didi in these villages, they can also help out by giving her some mental support.
How was her? How was she feeling, Sneha? Confident, and was she ready to carry out a pregnancy?
She was
And
very scared. She was not ready for to carrying the pregnancy, but she was scared to say that she is unwilling for pregnancy because she knows that the family member will not allow her to terminate.
she
So
was
she
not mentally prepared for
was not
motherhood.
mentally prepared, not knowing about the consequences. Now we have to assure her that even after delivering, she can continue her studies and she will get some economical support. Then only she will be relaxed, I believe.
Yeah.
We should also
Actually,
talk
they are
about contraception, ma'am, like to
Yes.
postpone the second pregnancy, which is
Yes.
yeah, we can talk about spacing for the next pregnancy, taking care of the baby. See, these are the teenage mothers. As pediatricians, we are seeing we have a lot of problems, issues regarding baby care also after birth. Even the breastfeeding rates are quite less, and they are not confident how to hold the baby itself.
True.
They are not prepared mentally to become a mother, and then holding
They
a
will
child.
need social support from someone
Yeah,
at least.
absolutely, absolutely. Actually, little bit I may raise some very controversial maybe issue. Here it is within marriage, so we are saying it's all okay. She has to carry on a pregnancy. है ना? There's a family pressure भी रहेगा कि आप carry करो हो गया है. But in her mind, if she's not willing to carry on, do we give the right for the mother to no when she's ready only to have? This is another controversial thing. But then when she's I think it is violation as rightly said by
Madam,
Piali.
that all leads to poor connection with the family. She will not eat properly. She will not go for ANCs, and that will lead to a poor baby outcome. That will
Yeah,
be a
actually,
neonatal outcome.
yeah, वो थोड़ा forceful हो गया तो yeah,
Very
she may not
difficult
cooperate.
situation here.
She may not cooperate and she's not willing to carry on this. So then it becomes very difficult. She requires very mental support, as she rightly said by Piali. But more than that, no, they may get into some attempts of abortion can be done silently without the family's knowledge. ये सब भी हो सकता है. So we have to talk to the child. She's how old is she? She's
18
18.
years.
17.
18 years.
Okay, okay. So then, yeah.
Madam, shall
So
we
this
go for role play? One more role play is there.
yes, ma'am. Like,
plan that, please.
Shall we start?
ma'am, you have to
Please,
stop
please,
sharing
please, please
screen.
go ahead.
I should stop sharing screen? Okay.
Yeah.
Stop sharing screen. कैसे करेंगे stop sharing? इसी को दबाएं? Stop sharing करो. करो.
If we're going to see the role play about a girl, a teenage girl who gets pregnant,
हटाओ ना तुम अपना हाथ हटाओ.
not yet married. So it's an unmarried teen pregnancy. Dr. Sneha ma'am will play the role of the counselor and I will play the role of the adolescent.
Okay.
Rita is 17 years, unmarried girl, missed her periods, and when UPT was done, it was positive. Hello, Rita. Please come and sit here.
Hello, doctor.
Hello, Rita. Please, do you need a glass of water?
Yes, doctor.
Okay. Sister, please give her a glass of water. Please sit down. Be comfortable. Have
Okay,
a
doctor.
glass of water. And then you see, in this room, we both are there. There is nobody else. So whatever you feel, you can communicate with me and you can openly talk with me. Okay? You are alone. How is your family? You have come all the way alone.
Ma'am, please don't talk about my family, ma'am. I feel so stressed. I don't want to talk about them. I
How
feel
many
so
members?
lonely at home.
How many members in the family?
Ma'am, I have my mother, father, and a brother. So my father is a businessman and I don't see him often at home. And my mother also works. She goes out with friends. She's part of all these page 3 parties. So literally, I'm alone at home, ma'am.
And about your brother?
Brother, he's my younger brother. He's in school and he has his own set of friends. He does gaming. He's busy with all his things.
So that means you have got no connection with your family. But you have huge house. So do you have separate rooms?
Yes, ma'am. I have my own room and I spend most of the time inside my room.
That's very sad. And which class you are studying?
I'm in 12th grade, ma'am.
So do you like to go to school?
Yes, ma'am. I like going to school. So my friends are there. So that is where my heart belongs to. I always like to be with them, have fun. I
And
recently come back to home.
you don't want to come. Then what about your eating?
Eating, I do eat at home times, ma'am. We have a cook at home. She cooks like most of the food. But sometimes I don't like to eat at home, so I order, eat out.
That means at dinner time also your family is not with you. Then what do you do at your leisure time?
Ma'am, I sometimes watch TV in the main hall, but otherwise, mostly I'm confined to my room. I have a TV in my own room and I have my gadgets, my mobile. So I'm happy with that.
So what kind of things you want on television? What you see?
Ma'am, like any of the series that is new in Netflix or Amazon, which my friends suggest.
But is it you can watch in front of everybody, or there is some content which you want to see alone? Because you told you watch television in the room. So anything special you are watching?
Ma'am, not really. I used to watch TV in my room. I have a TV in my room. I see all the series, but sometimes some inappropriate content comes. Like I do watch because I'm alone in my room. Nothing matters.
So after watching, you may like to stimulate yourself also. That may be the possibility you must be doing.
Sometimes I do, ma'am. Sometimes I do to just to divert myself. I feel so stressed sometimes.
And what time do you sleep? Late night?
During school days, like I go to bed by 11:30, and the chats, the notifications keep popping up. So it may it may even be 1 or 2 sometimes.
Then you must be feeling very sleepy in the school.
Yeah, of course, ma'am. Sometimes I feel, I mean, I've lost interest in studies. Like initially I wanted to become an engineer, but nowadays I've lost interest in studies. So it's so stressful.
You're not happy with your performance in the schools and studies at all.
My performance has come down recently, ma'am. I know that, but I don't know. I don't know actually what to do about that. So I feel so helpless. There's nobody to help me. Of course, I have my friends, but I like having fun with them. So it's really, I mean, I don't want to share my stress and sad feelings with them.
So
And
you enjoy parties with your friends. You like to go out. You want to explore the things. You want experimentation with the parties, life, everything. That you like. What you
yes,
see in your mother, you want to do
yes,
that.
of
Huh?
course, what's wrong in that? So my mother also goes to parties. So what's wrong if I go?
So whenever you go to parties, do you like anybody or any friend, or you have something like alcohol or cigarette with them in the parties?
Uh, Ma'am, like, are you sure that nobody else is outside
No,
the
no, no, no.
van?
I
Is the door
told in the
locked?
beginning.
Because I feel, I mean, something which I tell may be heard by somebody. I have a feeling that
It
somebody is
is
watching.
confidential. It is confidential. Don't worry. I am there for your help. Oh,
Does
no?
my mother know about this, ma'am?
No, no, no. Your mother doesn't know.
Okay, ma'am. So when I go to parties, so sometime I've had I mean, I've just smoked one or two cigars, and then I have had one or two drinks, like all with my friends, because like when I don't take, I feel left out. So they tease me, telling that you're a small girl and things like that. So I just want to try. And this boy Abhishek, so who is in a different section than ours, this boy, he used to talk to me, and I also talked to him outside the school hours. And so once we went to a party where he was also there, ma'am. I think I have feelings for him, but I haven't, told him it, or he also hasn't shared much with me.
But this is only once, isn't it? You are not having multiple friends or anything like that. Only Abhishek is close to you.
Ma'am, I do speak with the other boys and also girls in our class. We all hang out as a group. But this boy has been close to me of late. And I know how it all happened, ma'am. I'm really clueless.
When it happened, you did not use anything because you were you aware that this act may lead to pregnancy?
Ma'am, I don't know. It was like just like another party that we went, and we were all talking, hanging around. And then suddenly I was given a drink, and then I remember Abhishek like taking me to a room, and of course he was undressing me, and I don't know what happened after that, really, ma'am.
Was it a peer pressure to you?
Ma'am, I can't like, yeah, it is one thing that I wanted to share. Like most of my friends share these things with me, that they are friends with the opposite sex and they have had sexual encounters. But like so far, I have been able to refrain myself. But in this party, I really don't know what happened, ma'am. I really lost my senses.
Don't worry, I am there with you. But now, what thoughts are coming in your mind now?
I
Will
feel so
Abhishek help
bad.
you? He will support you? Or are you scared of him? Any safety measures you are feeling safe or unsafe at
I
this
feel
juncture?
so bad and shameful, ma'am. I just want to cry. I spoke to him like once or twice after this, and he told me he'll help me, but I don't know what to do, ma'am. I'm really helpless.
Just relax. That just I am there with you. But you know one thing, that since you are 17 years, alone you cannot come and consult me. And even Abhishek comes also, he is not of help to us. So we have to inform your parents, mother, for all these things.
Ma'am, please don't do that, ma'am. Please. Please, I feel so bad. Like I can't take this, ma'am.
I
Please.
will I
My
will
father
help you
knows.
out. I will help you out from this crisis. Definitely trust me. Trust me, I will help you. But we have to take the confidence of your parents.
Please, no, ma'am. Abhishek has told me that he will sort this issue out. He told me that we can solve this issue without, telling any one of us.
No problem.
What, ma'am, we can do this without informing my
It is
parents,
not
ma'am. Please.
possible. It is not possible. Just listen to me. Now we have to call your parents. Maybe not right now, but we have to call. And please don't hesitate, because they will be your support system.
Ma'am, I
Listen to
can't
me.
face my mother, especially my father, ma'am. Please.
Don't think like that. Don't think like that. I am there with you, and I will convince them that it was just an accident. It was not willful act. Maybe under the influence of alcohol, everything happened. And since you were not aware, you could not take any precaution like contraceptive pills, or you came little late also. Otherwise, I would have given postcoital pill. But now
What is that,
that
ma'am?
time has gone. Postcoital pills means, if by chance, if you are intimate with anybody or you have sexual intercourse within 72 hours, you can get the drug and then you can get rid of the pregnancy. So
I
at
don't
least
know
you are
about this,
not.
ma'am. No one of my friend told about this. They just said it'll be fun. Just go have fun.
That's what you
I didn't
must
want the
seek
repercussions.
medical advice. You must talk to the doctor whenever you go and have such accidents. You must consult doctor.
But what will happen now, ma'am? Will the police come?
We have to inform. We have to inform because you are
Please.
17 years old. You are not supposed to indulge yourself in all these activities, and it is against the law.
It'll be a disgrace to my family, ma'am. And what will society say? Please don't. don't-
Your health is most important for us, and I will bring you out from all this crisis. These are my words, but let me do what is there in the legal issues and the law. So you have to cooperate, please. You have to cooperate. Let me call your mother. Don't hesitate. Okay?
Ma'am, somehow I feel so good after talking to you, ma'am, but still I feel so
Just trust me.
helpless.
I will take you out from this crisis. Just trust me. But let
Ma'am,
me
are
call
you
your
sure?
parents.
Ma'am, what if everyone knows about this, ma'am? How can I go to school after this?
You don't worry because it is a confidential thing. Your
Oh,
friends will never come to know about what happened.
okay.
No,
What
sir?
if my name comes out, ma'am? Nowadays, like media, all sorts of news comes out. What if my name, my family name, everything comes out in the media? Then I'll do something, ma'am.
No. You have to take courage. We will get some support system. There
Are
are
you sure?
counselors are there. Counselors are there. They will help you out how to come out from the crisis. The support system is there. Counselors are there, and they will help you out.
Are you sure this will be confidential, ma'am?
Yes.
No one will know about it.
It will be confidential. We will we can avoid media. We can talk to the parent. First, let me call your parent and then we will decide. Okay? Okay.
Okay, ma'am.
Thank
Okay.
you. Thank you.
That was great. Uh, very, very sensitive. And Lakshmi and Sneha, thank you. I think we should give a big round of applause to both of these. Dr. Piali, I think you will also endorse it. It was
It's
so well,
Lakshmi.
very, very
She acted
difficult,
very well.
very.
Lakshmi acted very
I
well.
know she was crying, and Lakshmi was looking very sad, very
And
concerned, and she was
Neha was
so,
also very patient with you.
yes, very compassionate. And one thing is, one question was there in the chat box. Are these not very direct questions? Like some other questions, are you stimulating yourself or how this thing? I think the answer would be
Madam,
like,
once the
yeah,
pregnancy test is positive, that means the girl knows everything. So there is no point in taking her here and there. UPT is positive. That means the girl should accept. And why to talk then indirect questions when it is positive?
so
Whoever
what do you
has
say?
asked,
We are
na,
getting,
Hima,
yeah,
I think once the person, the pregnant teen is comfortable with the counselor or with the pediatrician, it is always better to ask direct questions. I mean,
direct
beating
questions. I
around the
also
bush
agree with you.
never helps.
Yes, I
And the
also
teen
agree,
was
Piali.
actually answering her because the teen at this point of time is in despair. So the teen will be seeking help, trying to diffuse the situation, and maybe the direct questions will bring out the true picture.
I agree with you, and I also endorse that. At this point of time, when everything is now, this is not the time where we are thinking about how to question. We have to go direct, not beat down the bush, and this will actually bring. We now we have done this for last so many years, beating around the bush. Let's come direct now. And as you said, now she's ready. At least she's not uncomfortable. If the teen is uncomfortable, or then you can maybe modify the way you're questioning, but if she's able to give you answers and she's not feeling uncomfortable, it's better to go for direct questioning.
Well, one
So
thing we missed in this role play was whether the act was done under pressure, like under coercion. So that is one thing like we need to ask.
consent,
Because it
with
was under,
consent of
yes,
course,
consent.
consent.
Consent, that is
Because
very
actually what you
important.
said was that in
But
this role play, we covered that she was under influence of some
of a
drugs and she
drug,
was not
yes,
aware.
there was a date
Whether,
rape given, so there is no issue of consent in this.
Mm.
okay.
And in case, but we can have another case scenario where this issue can also be discussed if it is not without, if it is with consent, without consent. This she's 17 years old. So with or without consent still comes under the law for us in this case situation. Yeah. So, but then the things were a little different for counseling. If it is a with consent, without consent, वो assets में थोड़ा सा difference हो सकता है, but both will come under POCSO. And there was another question whether we should inform the parent because she is not willing. We have to inform here in this case at present way the POCSO and the legal aspects are. There are debates going on consensual sex ke liye, should we be so strict about it or criminalize things. So the debate is going on. The courts are giving some verdicts, but it will take time for that to come into law as part of law. Right now, we have to all abide by this law and the act, where below 18 years, any act, whether it is with consent or without consent, within and without marriage, all are come under POCSO Act.
So police
Yeah,
also have to be-
consensual teenage sex under the law, they have been favorable towards it. They are not strictly punishing. And I believe there will be something coming out for the 16
Yes.
to 18
You have to
years
wait for
old.
it.
There
Yeah.
have been
For
many
16 to
out of
18.
court settlements, ma'am. In the recent years, there have been many out of court settlements.
I do
Yes.
not agree that marriage will actually settle this problem.
Yeah.
You
Out
just
of
get
court,
them
yeah.
married and it will be all
Sometimes they
right.
say शादी कर दो तो legalize हो जाएगा. I think that is not going to. I think we as an academy also, I think, are not in favor. We are more worried about the age of the child also. We don't want teenage pregnancies at all. And below 18, तो वो भी एक aspect है. He has
See,
technical.
these are not wise decisions or thought of decisions. These have been done at the spur of the moment. And life is not decisions at the spur of a moment. You need to wisely think about whom you want to spend your life with. So, shadi kara dena is not an answer to this.
Absolutely,
So there is a question on informing the police. Yes, we should inform the police. It is mandatory.
Yes.
And the child welfare committee, which the police will inform themselves.
Yeah, this is why Hima has always been saying ki preconception care, comprehensive sexuality education. So we are actually giving them the scope to make informed decisions instead of being coerced into decisions. So if you give them comprehensive sexuality education, you have done your job.
So in nutshell, if you want to say, any sexual activity below 18 years of age will fall under POCSO, must be informed to police. That is first lesson which should be.
For child welfare committee, if you do not want to directly call the police, because
Yeah,
sometimes
the
they get
CWC.
intimidated. Yeah.
So WC just, yeah, even the one centers, I mean, can be called.
One-stop
Second,
centers, yes.
one
they
stop
can be
center.
called.
1098, you can just inform 1098
Child
and all the
right.
things will start.
Yeah.
All the
So
procedures will
yes,
be followed by them.
informing the
Just
authority, be it be a police, juvenile justice board, or 1098 or one stop center. That is the first thing, which is the first message. The second message, because somebody has asked that whether the boy will be punished or not. In that, again, the age
Definitely.
of boy matters. Ma'am, if the boy is more than 18, because Neha is 17, if the boy was senior or more than 18,
Still.
again the adult trial will be done.
Yes.
But if the boy is less than 18, then there are again two things which
Juvenile.
juvenile. I mean, again in that they say if it is less than 16, juvenile justice board, between 16 to 18, see the maturity of a child.
Yeah.
That is
So
one
it's
more
borderline.
thing which is a catching point. That if the child is mature, then the child can be considered as an adult between 16 to 18. And if the act is such, see, pregnancy, forget about the pregnancy, whether pregnancy is there or not, but the sexual act, if it is there. Yes, sir. Nishikant, sir, something you want to say?
It is the concept of major minor that Prashant is talking about. In foreign countries, we have that concept that the minor is treated as a major if we think that he has voluntarily coerced or been violent or violated the girl. So that concept of major minor has not come in as yet in India, but in the near future, we may see that.
I see.
So that is what the concept of close in age exemptions, which I was mentioning in my talk.
A lot of questions on sexuality. Nishikant sir. Yes, sir.
It was a wonderful presentation, and there are many things which are coming out of the box, because it is very difficult whenever you are there to inform the police, because you do not really know when every party, these parents, both the parents, The boy parents and the girl parents, they are coming down to you, and this is what has happened, the pregnancy. Now your job is to inform the police because it comes under POXO. Now here we have a social problem, that are we creating a problem? Though I understand that we have to inform, but here are we solving the problem is a debate which is going on in POXO also. Because if the thing has happened, see, the MTP Act also came only because the woman herself can give consent alone without a husband, or without, whenever she is married and over 18 years, only because they were suffering because of this. Okay, they were tortured because of this, and she can go to a doctor without telling anybody and get MTP done. Here are we creating a problem for our own adolescent, that girl, supposing she's our own adolescent? Now it's a very difficult question to ask. It is very difficult. It is very easy to give answer in a examination.
Sir, I just want to add one point here, sir. Even if the parents miss to inform the police or not registering the case, suppose they want to take the girl for an MTP, the girl has to be registered under a central number, especially in the state of Tamil Nadu, for any abortion or for even undergoing an ultrasound scan to confirm pregnancy, the girl has to be registered. So when we register the girl with a nearby government institution, they naturally inform the child welfare and the social welfare committee, and finally it goes to the department. So without that RC, we call what is called the RCHID, without that number, they cannot even get a scan done, especially in the state of Tamil Nadu.
The
So
government
this
sector.
is government sector, yes, ma'am. So
Okay.
any
But
pregnancy has to.
the statistics is that the cases are solved properly and in a compassionate ground, or they are solved in a legal tangle.
Sir, like most of this same-sex adolescent sexuality, like there have been reports of out of court settlements, and the judges have like given the verdict in favor of the boy, because criminalizing adolescent sexual activity is what like we are against. So this rule, this POXO rule, was to create a safe thing, but again at the same time the boy is criminalized. So he's also, his future is penalized. So this is where like we are hopeful that especially in the last Samvad class, they were discussing about this. So the judges nowadays are like giving judgment in favor of the boy
Is
also.
there? We have to
Here
wait
there are
for
not
this.
many problems which have come because rape drug, dating drug, whether it was used, that is an illegal activity, I can understand. And whether then the people who are on the board now, whom I am able to see, are of the opinion that otherwise also they are in activity, then why 18 years and above 18 years is now in 2025 considered to be age for consent?
That is the I think as an HA, technical things we can see there, but we are not there. We have to go by the
True,
law.
very true.
So once
I
we are
totally
still
agree.
debating, and can give our opinion. It is all under debate. We all know that. कि वो जब तक वो हम लोग as a technical, we want to preserve and protect our adolescents, help the adolescents. So with that angle, maybe yes, when consensual, what to do, it is going on. So let us wait for the natural debates to
the,
happen. And
सर एक बार
so the
प्रेगनेंसी हो गया
ideal
तो
thing,
अभी एक
ideal
बार
thing
प्रेगनेंसी
here,
हो गया तो सपोर्ट तो करना है सर उसको, नहीं तो गलत अबॉर्शन होगा, जान चली जाएगी बच्चे की.
करेक्ट. नहीं तो मेरे को हेमा बिंदु एंड डॉक्टर पियाली, लक्ष्मी शांति, प्रशांत एंड स्नेहा, आई थिंक what is really right is to convince the society that we have to give them knowledge about contraception.
Sir, I want to speak one thing here, that since the age of menarche has gone down and the age of marriage has gone up, so almost there are 10 to 12 years in which the children are sexually active. So we have to make some changes, and we have to teach them, because otherwise this long period we cannot say that ki keep mum. This is not possible
But
these days. And children are
Sneha,
going out, sir, after 10th standard, they are going out for studies. Their whole youth is away from the parents. We are talking about parenting, but they are not staying at home. They are staying in hostels. So peer pressure is too high. and the
But the only thing is, so give them a knowledge about
yes,
contraception. Is
Nishikant
you
sir,
can prevent
uh,
these things. That's all. Because we cannot say anything about consensual 18 साल के नीचे का है वगैरह ये तो सब law है और law तो you will have to abide by the law. You can
abided,
change
but
it
yes,
later on, but you have to abide by the law. But the only thing which can prevent this type of thing is making
comprehensive
girls
sex
aware
education.
that whenever they go out, they have to take care of drugs, dating drugs, and these things
yes.
which can occur, and contraceptive measure
Yes.
post coitus, as she rightly said, at least immediately. They must,
Sir,
whatever
this is
has happened, guilt and everything is forget about it. But major, our aim is save the adolescent.
Yes.
yes, sir. With that ultimate aim, that adolescent, we have to understand them instead of making them, feel shameful or guilty about it. We have to help them, and that is our intention. And we also definitely want them to have knowledge. So, bolna seekhna, we have to start talking to them about their body parts, the function of these body parts, intercourse, how sexual sex happens, how when the babies are formed, what are the consequences. सब बोलना है. But at the same time, they want to explore. हम उनको abstinence के बारे में बोलेंगे, but we all know that this is part of the development. Attractions are there, how they can restrain themselves, the life skills. Do they have enough life skills to say no? Can they say no? And they want to
Initially,
experiment.
when it started, this comprehensive sexuality education, when we called it sexual education, there was a huge hue and cry. Nobody wanted to accept it in schools
Yeah,
also. But presently, I think many of the schools have started.
open
So
up. Yes.
there is now open discussion. So things are changing. Maybe today we are reporting and we are feeling bad कि हाँ बच्चे के लिए पुलिस में report कर दिया या parents are saying don't report and there are friends maybe but we still need to report. हम सोच रहे हैं हमारा पीठ बचा लें पहले नहीं तो हमको फाइन होगा हमारा practice effect होगा. So but those things are all there and under such pressures also we need to help out as much as we can अपने दायरे में रह के.
IPL, what do you think about IPL? Prashant?
Sir, what
Sir,
is it?
this is a endless
आईपीएल तो
discussion because
देना
this
ही
is
है आईपीएल तो देना ही है अगर if there has been under coercion under abuse even consensual and if
yeah.
she is asking for a contraceptive तो within 72 hours हमें आईपीएल देना ही देना है.
But the most
Tamil
the
Nadu,
common message I think is any sexual activity below 18 will fall under POXO. You have to inform. How you inform depends on you. You will be empathetic to adolescent, but if you don't inform, you will fall under section 21 of POXO, which will be a problematic for you. So you have to inform. Most important thing, always, I mean, this is extra thing which is there. Whenever we are doing a counseling, the counseling room should have some audio videos also which can protect you legally. That is the most important thing. And ma'am, there will be so many questions which will be coming, but I think it is
I
already
think,
12:10.
there is a question
Prashant,
on
I want to
26
just add. I want to just
activity.
Okay.
add one thing that question what AHA is doing. So, as a chair of AHA, on behalf of all of us, I want to just express that having realized that sexuality, sexual education has to be taken up in a big way. So, we came out with the comprehensive sexuality education module. It is there on our annual, and also through this youth wellness program. The mandatory session is sexual wellness. We have taken up with these college students and school children can understand at their level उनके language में और उनको involve करते हुए ये module बना है and very soon we'll be conducting this programs throughout the country. I hope this will help the pediatricians to go and talk about sexuality, healthy sexuality in a comfortable way and with confidence in the schools and colleges.
So it is more
So
of sexual wellness है ना हिमा.
wellness,
It is more of
wellness,
sexual
all
wellness.
wellness, all
And
wellness.
Nishikant sir पूछ रहे हैं Nishikant sir you know the actual state of if I said the fact these teenagers know everything more than us. I was to conduct a session in my son's school and my son asked me what you are going to do. So I said it is on sexual wellness and he gave me a big laugh and he said हमको सब कुछ आता है. You just type the 3 magic letters on Google and you'll get everything out of it. So that's what my boy said to me. They know everything. Only thing is that we need to guide them how to go about it.
Actually, I also feel that most of the boys and girls are getting knowledge, but we want to when we conduct the sessions, we can make it applicable. Like, think that if this has happened to you, what will you do? So just stimulate their thought process. So how will they act? Just give them situations. Now the girlfriend or boyfriend came and proposed to you. What will you do? So let us then we can initiate the talk and about safety, all those things. So I think we can conduct the sessions still, even though they had knowledge through Google and all that. Still, they would look forward for people like us who can boldly and talk them directly, scientifically about sexuality. So let us go
Madam,
ahead and walk.
One
Sorry to
line
interrupt.
only.
Madam,
One
everything
line
is there
only.
on
The
the Google.
internet gives you information, and we give them knowledge. A little
Yes.
Knowledge.
difference between what they know and what we know. That is that line we have to do.
And sir, other thing is that we give age appropriate knowledge, and the Google, it is there for everybody, whatever may be the age. So it is irrespective of age, and we will educate them according to their need and age appropriate. That is the difference.
Thank you. So I think we are ending with
not
positive note.
same sex sexual activity whether to be reported, ma'am. Hima, ma'am.
Yeah, same.
If there is the same sex sexual activity, maybe
Below
LGBTQ
18,
before
18,
18.
Yes.
below 18, yes.
Okay, okay.
Simple. FOXO,
After
gender
18,
neutral,
it's their
below
choice.
18.
Well,
Yes.
gender neutral is boy or girl. That's okay.
Yeah.
But there
No,
are
that is
some
fine.
Any
Between
sexual
boy and boy,
activity.
girl and girl, or boy or girl, anything. But below 18, any sexual activity, report
Yes.
it.
below 18.
If
sex.
one of the individuals is less than 18,
Yes.
then yes, definitely yes.
Even if one of them is below 18, yes.
Fine. So thank you so much. I mean, this is a session which can last for day also. But I mean, all the experts and faculties, you are wonderful. We are thankful to the MKC Nair sir also. He was there in the beginning. And I will just post the post test. Those who are asking for the recording will be posted by tomorrow. Give me a day. And we'll meet after 15 days. Remember, every 15 days, we are having 3 to 5 every alternate Friday. So thank you so much, everyone, for the being a nice audience. Yeah, thank you.
Thank